Testosterone is a hormone that males produce for reproduction. Do you feel that your libido isn't what it used to be? That you're weak? That you don't have the energy to get out of bed in the morning? That you can't focus on your work? Or that you can't spend quality time with your family? There's a good probability you're suffering from low testosterone, sometimes known as low T. You might be curious about how testosterone levels drop. Be sure to watch the video in its entirety to find out which food might be killing your testosterone levels and which food items you should strictly stay away from. Humans and other animals produce testosterone, which is a male reproductive hormone. The testicles are the primary producers of testosterone in males. On the other hand, women's ovaries generate testosterone at lesser levels. Testosterone production spikes throughout adolescence and then drops at the age of 30 to 50. Testosterone is most commonly linked to sexual desire and is essential for sperm production. It does, however, have an impact on bone and muscle mass, as well as how men store fat in their bodies and red blood cell formation. As a result, a healthy level of testosterone is critical for general wellness. It also gives you more energy and strength. Products made from soy. Isoflavones, a kind of chemical found in soy, are abundant. It's a chemical that looks a lot like the feminine hormone estrogen. Estrogen is in charge of breast growth, voice alterations, and other bodily functions. According to research, isoflavones in soy, which is considered a testosterone-lowering diet, may help reduce testosterone levels. It's because soy products activate estrogen receptors. Isoflavones appear to enhance estrogen levels, according to contradictory research. As a result, it aids some people, such as postmenopausal women. In normal circumstances, estrogen has a role that is diametrically opposed to testosterone. Phytoestrogen, on the other hand, blocks androgen receptors. Sperm production, motility, and viability are all affected by testosterone deprivation. It also has an impact on men's secondary sexual characteristics. It can help to prevent the development of muscular development and strength, body structure, the tone of voice shifts. Milk and dairy products. Full-fat dairy products may contribute to sperm count reduction. According to one study, there may be a relationship between consuming more dairy foods and having higher follicle-stimulating hormone, FSH, levels. FSH is a hormone that stimulates the formation of new cells in the ovaries. It's a sex hormone produced by females. It is, nevertheless, found in men in trace concentrations. Its goal is to boost sperm production. On the other hand, excessive dairy consumption raises the levels of this hormone in males. As a result, high levels of FSH can lower sperm count in men. Mint is a flavorful herb, spearmint, and peppermint. Mint is present in your candies, chocolates, and other confections. Furthermore, it may be found in a variety of cosmetic items, such as medications, toothpaste, and soaps. Menthol, which is found in mint, has a detrimental effect on testosterone levels. According to research, mint, particularly spearmint, causes oxidative stress in testes cells, resulting in radical cell damage. As a result, two hormones, luteinizing and follicle-stimulating hormones, are produced less. Furthermore, another study reveals that not utilizing peppermint as directed may negatively affect testosterone. For sperm creation, our bodies require only a small amount of these substances. The amounts of these hormones are reduced by free radical cell damage, which affects sperm production. To stay on the safe side, limit your intake of mint-based meals. Root of licorice. Another food that lowers testosterone is licorice roots. It contains a large amount of glycyrrhizic acid, which neutralizes enzymes that aids in the creation of testosterone. Furthermore, both men and women can benefit from licorice roots, since they suppress testosterone levels. Vegetable oil. Vegetable oils that have been refined can create a variety of health problems. One of them is lowering testosterone secretion. Polyunsaturated fatty acids are abundant in vegetable oils. Monosaturated fatty acids have been shown to reduce testosterone levels in studies. Vegetable oils also cause the formation of free radicals. It damages cells by causing oxidative stress. Obesity, diabetes, heart disease, and other disorders are all caused by radical cell damage. Obesity and diabetes affect testosterone production once again. Omega-3 and omega-6 fatty acids are also found in vegetable oils. When ingested in the prescribed amounts, omega-3 is beneficial to the body. However, other forms of fat, such as omega-6, impair testicular function. Excess omega-6 free fatty acids have been shown to be detrimental in several investigations. Furthermore, they reduce testosterone synthesis. Vegetable oil is harmful to testosterone levels because of all these causes. Trans fats. Trans fats are the most detrimental sort of fat for your health. Most trans fats are found in vegetable oils. Margarine, fried and processed foods, and packaged foods all include them. The trans fat is formed when the oil is reheated. Trans fats are also extremely inflammatory due to the way they are prepared. As a result, the risk of chronic illness may increase. Furthermore, within an hour of eating, polyunsaturated fatty acid lower testosterone levels. Obesity, metabolic problems, and diabetes are all caused by trans fats. In addition, testosterone synthesis is inhibited by some health conditions. According to studies, aromatase, an enzyme that transforms testosterone to estrogen, has been found in body fat. Estrogen is a female reproductive hormone, as we all know. Excess estrogen inhibits testosterone production. As a result, testosterone levels are reduced. Nuts. Nuts are nutrient-dense foods with a variety of health advantages. On the other hand, certain nuts have a detrimental impact on testosterone levels. Almonds, peanuts, pistachios, and walnuts, for example, reduce testosterone levels by increasing the sex hormone-binding globulin hormone, SHBG. Furthermore, it binds to testosterone and inhibits its release, hence limiting its actions. Nuts are also high in phytosterols, a substance that is important for heart health. Phytosterols, on the other hand, can inhibit testosterone production. Nuts also contain a lot of polyunsaturated fatty acids, which lower testosterone levels even further. Almost all nuts have a mixture of different fats. They are not dangerous as long as they are consumed in moderation. To gain additional information, talk to a doctor and a dietitian. Flax seeds. Flax seeds have been shown in studies to lessen the risk of prostate cancer. Because flax seeds are rich in omega-3 fatty acids, this is the case. They also provide a variety of health advantages. It enhances heart health, for example. It also protects against hypertension and stroke. It does, however, contain a high amount of omega-6, which reduces testosterone levels. Lignans, which are plant chemicals, are abundant in flax seeds. They have diverse ways of lowering testosterone levels. They attach to testosterone and prevent it from freely circulating. Lignan also causes testosterone to be excreted. It also stops testosterone from being converted into dihydrotestosterone. It is testosterone in its active state. SHBG levels may also put you at risk of having poor testosterone function. Alcohol. According to a recent study, drinking alcohol on a frequent basis might be hazardous over time. It lowers your testosterone levels, especially if you drink heavily. In addition, multiple health problems are fueled by alcohol usage. Alcohol, for example, impairs the activity of sperm-producing cells. Sterol cells are cells that inhibit the release of reproductive hormones. It also inhibits the release of the hormones LSH and FSH. As a result, total male fertility is reduced. Hormones that control your reproductive cycle and sperm maturation are known as androgens. Furthermore, alcoholics have high amounts of estrogen. Estrogen is a hormone produced by females. It has the opposite effect on the body as testosterone. Infertility and a decrease in male secondary sexual features may happen as a result. Among the signs and symptoms are hair on the face and chest is decreasing, enlargement of the chest, fat deposition shifts from the belly to the hips, commercially prepared baked goods. Your testosterone levels are lower if you eat professionally baked goods. Bread loaves, pastries, donuts, and other foods are available. According to research, males who eat baked goods on a daily basis have lower testosterone levels. This diet also stimulates fat deposition around your stomach and raises abdominal fat. Your testosterone levels are suppressed by abdominal obesity. Furthermore, baked goods include trans fats, which reduces testosterone production. Fried food. Polyunsaturated fatty acids are more abundant in fried meals. As a result, testosterone secretion is inhibited. Conversely, polyunsaturated fatty acid absorption is boosted by even mildly fried meals. Furthermore, fried meals contribute to obesity. Inflammation in the body has a direct impact on testosterone levels. As a result, you should avoid fried meals, particularly deep-fried foods. Steam meals are an alternative. Processed food. Trans fat and artificial ingredients are included in almost all processed meals. As a result, they have an effect on your testosterone levels as well as your general health. Processed foods include vegetable oils in addition to trans fats, making them high in polyunsaturated fatty acids. Processed diets are harmful to testosterone because polyunsaturated fatty acids and trans fats lower testosterone levels. Lifestyle and nutritional changes are one of the most efficient ways to maintain optimal testosterone levels. It is also beneficial to your general health. Regular workouts and proper sleep are also part of a healthy lifestyle. It would be best if you also ate meals that enhance testosterone. It's impractical to avoid some foods, particularly those high in fat and sugar. Let us know in the comments whether you have been consuming these food products or not. And do you think it affects your testosterone level?